If you or a loved one have been affected by suicide, this video presentation is for you. First, we want you to know you're not alone. Broadway Media wants to support you in finding ways to deal with risk factors like bullying, addiction, depression, and more. We'll also help you, we hope, recognize the warning signs so you can support the people you love. Be a part of the movement turning hope into action. This video podcast is made possible with support from the American Foundation for Suicide Prevention, Nightingale College, and the Advocates. And remember, if you're in distress or have a loved one who's in distress, dial 988 now. Hi, Taryn.
Hello, Bill.
It's nice to see you.
You too.
I like your new hairstyle.
Thank you so much.
Ladies and gentlemen, this is Taryn Hyatt. She is the area director for the Utah chapter of the American Foundation for Suicide Prevention. And we've been friends and associates for a long time now.
I think we're coming up on 11 years that we've been doing the walk together.
No, it's
12?
more than that, isn't
it?
12?
It's got to be at least 12.
Yeah, we'll talk about the walk coming up, the Out of the Darkness walk for suicide prevention. But big news, and that is the 988 number.
Yes.
It's a number, a 3-digit number that people can utilize if they're feeling the pressure, if they're feeling thoughts of what do they call it? Ideation?
Yeah,
So if they're having thoughts of that, they can dial 988 or punch it in the buttons. Nobody dials a phone anymore.
I know, right?
So let's talk about the history of 988. It seemed like it was a real struggle to get that. And why can't somebody just say, okay, there it is, 988? What was the history of that?
You know, it was a huge process. So Senator Dan Thatcher actually brought the idea here in Utah to our Safe UT Commission after the Safe UT app was created, right? We thought, why not have a 3-digit number, easy to remember for people to call during crisis? But then we said, well, if we're going to do it, it should be nationwide, right? Just like 911. So there was an entire process that had to go into, looking at what number could be designated. You had to get approval through the FCC. Funding had to get put in place. An entire infrastructure really had to be built to ensure that if we move to a 3-digit number, we know that call volume will increase. So that means our crisis centers have to be staffed, have to be ready to accept these calls and able to do that. And so, it's been years of effort, but we went live on July 16th.
Do you remember when you actually started trying to get this done with Dan Thatcher?
Yeah, almost 8 years ago.
8 years ago?
It's been a journey.
And thanks to Dan Thatcher.
Absolutely.
I've had the pleasure of talking with Dan several times, and he's a great guy.
He is a good guy.
And this is suicide prevention is very important to him, I know.
He is a champion for our cause.
So 988. So when someone is feeling they need some help, and they dial 988, what happens?
Yeah, so what happens is you're routed to your local crisis center based on your area code. So if you live here in the state of Utah, you have an 801-435 number, you're routed up to Huntsman Mental Health Institute. If for some reason you have an out-of-state area code because you moved here like some of us do, you will be routed to the crisis center based on your area code, and then they can transfer you back over here.
Why is it important to have that, to have it go to your local rather than just some national bank of help?
Because we want you to get services in your area, right? Like our local services, our local folks know exactly where you can get support, help, what mental health resources are available in your community. Again, at the touch of the button, at their computers, they can guide you right to the closest crisis center. They can administer and call out our mobile crisis teams if need be.
That's what I was going to ask.
And that's a huge benefit.
Yeah, if it's like an extremely urgent, a dire situation where someone is, I'm on the verge here, and can they send somebody to help?
So what happens is again, about 90% of people who call the crisis line, their crisis is de-escalated just on the phone. They don't really require any additional services. However, some, as we know, might need, extra support. So we have what's called a mobile crisis team. It is a peer support and a social worker that'll come out, again, plain clothes, no lights and sirens, right? Not an ambulance, and meet with you at your place of business, at your home, and again, just talk through what it is that we need to do. There's also receiving centers. It's a terrible term for a mental health ER. So, Huntsman has one. We have them in Utah County. We have them in Davis County. We're working to expand those so that we have them in rural parts of our state.
So
St. George.
so you can say to the person, why don't you get yourself to this,
Yes.
this.
Yes. And again, these receiving centers are an opportunity to be seen without ability to pay, right? Without insurance. Again, you don't have to get put in a gown like you would in an emergency room. You don't have to be treated sometimes criminally. That's
Yeah.
how we treat people.
Yeah.
This is about providing a mental health response to a mental health crisis instead of treating it as if you've done something wrong or we need to be in fear of you. And so it's really a way of looking at our crisis system differently. And again, not relying on law enforcement to do a job we have not properly trained them to do.
Yeah. If they determine, and I guess the people who are trained to do this, to take the phone calls, they know, I assume they know the certain cues and signs, and there are little hints that they can
Absolutely.
get. And if somebody is really close, on the verge, do they have to get permission to send somebody to help them?
So, no, we ask for permission, but if we know somebody's in trouble, then we'll treat it the same
Just
as
do
a
it.
medical emergency and we'll come.
Yeah.
And then if it's a suicide in progress or something that's imminent, then absolutely law enforcement will be called. Now, something else that's unique in our state is we've been working really hard. Angela Romero ran a bill last year to ensure that crisis intervention training happened for all of our officers. And so we're working to expand that just to make sure that they, when they respond, have the training to de-escalate a mental health situation.
So we're talking about 988, and if anybody watching this right now, you could use that right now if
Yep.
you need to. If you feel that
Absolutely.
you're in need, or if you're having a crisis, call 988. And do people, you think, feel an embarrassment or a stigma sometimes? Well, I can't do that. I just can't do that. How do you reassure them about that?
I think that what we need to understand is that, again, if I was having a heart attack, I would not hesitate to call 911. If you're having a brain attack, that's what I call it. When
Yeah.
my brain goes into that dark place of thinking I can't do this anymore, we need help. And this is the same and just as important as our physical health, right? So we need to take that initiative. If my brain is in a dark place, call and get support. This is a medical emergency too.
Yeah, this is a
And,
health.
yeah, it's a health
health
issue. Yep.
Yeah, excellent. So let me ask you. There's something on here that I don't understand. You gave me some questions here. There's a MCOT. What is MCOT?
Those are our mobile crisis response teams,
okay.
yeah.
Okay.
So we have those available throughout the state. We again looked to last legislative session increase funding so that we could get about 15 more. That bill did not go through. We're going to be back this next legislative session, really working to ensure that we have these. Because again, we want these in Delta, Duchesne, right? Rural parts of our state too, not just in urban, Salt Lake City and Utah County. We want to have these accessible everywhere.
But Taryn, people out in the country, they don't have mental health problems,
Right.
do they? They just have a wonderful life.
Yeah.
I think it's
Nope, it's
probably
everywhere.
maybe. Well, it's everywhere, and
It's
maybe in
everywhere.
some instances
Some of
in
our rural
rural,
communities it's
there's
higher.
isolation and loneliness.
Yep. And limited access to resources. So absolutely.
Are these centers, these receiving centers, are they? We should think of a better
I know.
name for those.
Yeah, we're working on that. But they're really a diversion because if you think about it, a lot of people who are, again, either in a mental health crisis, let's say maybe they're intoxicated and struggling with substance use, right? They're often taken to jail. And again, that doesn't get them the help and support they need.
Yeah.
If we can get them to a receiving center where they can be treated, they can have an assessment done to see what steps are needed to possibly get them into some treatment options first. Again, we want to treat people's mental health, not criminalize it. So that's one of the opportunities these receiving
Are you
centers
trying to staff
offer.
those at 24 hours
Yep,
a day, or
24
are they?
hours,
They
they're
are.
staffed 24 hours a day.
Do you have any idea how much it costs to do that for each one?
They're a lot, we looked at, again, pulling this off the top of my head, it was $15 million was the bill that we had to bring forth just even 3 more receiving centers.
Three
So
more, and there's
they're-
about
yeah,
15 million.
It's a heavy lift, but
Yeah.
they're necessary.
And it should be funded by the state.
Absolutely,
Yeah.
absolutely.
Taryn Hyatt, the area director for the Utah chapter of the American Foundation for Suicide Prevention. If you have lost someone to suicide, as I have. And it's been a while now, and something that it scabs over eventually. But how can you help those people that have lost someone?
Yeah, and I appreciate you always being open about your loss of your brother Noel. And, as you know, I lost my dad, and it'll be 20 years for us this year. And it's just amazing to think it's been that long. But, survivors of loss are also at increased risk to struggle and have thoughts and feelings of suicide, too. So it's so important that we get support. But it's also important that our community understand how to respond when a suicide death does happen. Because we call it's called postvention. And we actually are getting ready to release a new toolkit that'll go out to communities to help them understand how to respond safely. Because, we've seen in the media over this last year, a couple suicides that were really high profile.
Yeah.
And again, when we're not reporting safely on them, when families who are newly bereaved, again, in their grief, share very graphic and open details, it can be harmful to others who are struggling. So we really want to get connected to families right away. Our medical examiner's office helps us do that. They send outreach, they make phone calls. We want people that have lost somebody to get support. Again, understand that sharing your story matters, but it also matters how we share it. And so we want to do those things safely. But AFSP has a ton of resources. We offer a healing conversation peer program where we can connect you to support, to local support groups, because you deserve to have that care and compassion as you grieve.
And it's important to have tools to get over your grief, and also suicide can be infectious in a way, and that's sort of what you're touching on here. There are ways to prevent it from spreading.
Absolutely. We call it contagion, and it's a phenomenon that typically happens among youth, but it can be contagious. Again, not giving people the idea who aren't thinking about it. That's not what we're saying.
Yeah.
But we're saying when somebody is already struggling and we talk about suicide in an unsafe way, Robin Williams was a great example. When he died by suicide, it was shared very openly, graphic details of how, and that's where we saw people mimic that behavior. So we do have to be cautious in how we talk about it. But again, it's so important that survivors of loss know they're not alone. There are people who will support you and walk this journey with you. And again, we need that. We need that community support.
The number you can call right now if you need to, 988. Do you have any idea what the volume of calls has been since it went live?
It's definitely gone up. We knew that, and we've been prepared for that. Again, we're fortunate in the state of Utah that Huntsman Mental Health Institute was ready, and some states have not put a plan in place. And so it's really important moving forward. This is going to be a process, right? It's not going to be perfect. I know we're going to have hiccups. Think of when 911 rolled out. It took time to get everything in place.
There's still been some problems
there's still hiccups.
with the jurisdictions.
Absolutely. Yeah. So again, we need people to understand that this is a process, but help us, right? Be part of the solution. Please help us this year advocate for the funding that is needed to make sure we have, these resources in place for people.
Of course, one of the ways that people can help with the funding is the Out of the Darkness walk, September 10th.
Yeah.
Talk about that a little bit.
Yeah, so this will be our 16th annual walk. It happens to be on World Suicide Prevention Day. This is a walk to fight suicide. It's how we raise money and do the advocacy work that you spoke of, provide the support to survivors, do education in our communities, fund research. So invite you to come out and join us. It's for anyone who's been affected by suicide or just cares about preventing this leading cause of death. Yes, it's a fundraiser, and we hope to raise about $375,000 this year. So we're well on our way.
And now, lest you think that this is this walk to prevent suicide, this Out of the Darkness walk is some gloomy weep fest. It's not really. I mean, there is some. There are some moments of tears, but it's sort of an uplifting, upbeat event too. Yeah. It's quite. I was astonished when the first time I was involved with it. People are just incredible, and they're so grateful, and it's so important for them to get together, share their stories, know that they're not alone. And it's a great deal.
I want to see the 10,000 we saw before COVID, huh? Wasn't that amazing?
Yeah, we could.
I don't know that we'll get there, but we had thousands of people walked.
Yeah, Liberty Park. They couldn't hold all the people.
We had to move. Yeah.
So moved to where is it?
West Jordan Veterans Memorial.
Okay, and how do people get involved with the walk?
Yeah, so visit afsp.org/SLC. You can register. We're looking for volunteers and helpers, but just come and participate.
It's nice not to have to do that 800 number again
Yeah,
anymore
right?
because I could never
Easy to
remember it.
remember.
Yeah.
That's why we needed the 3-digit.
Yeah. 988. You can do it right now if you're watching this, and you can do it right now. Taryn, I'll see you on the 10th.
Okay.
It's always a pleasure.
You too, my friend. I love you. Thank you.
I love you too. Taryn Hyatt, Area Director for the Utah chapter of the American Federation of Suicide Prevention. See you soon.
Thank you.
If you're struggling with thoughts of suicide, there is hope. There is help. Call or text 988 or text TALK to 741-741 right now and receive assistance that you need to get you through your crisis. This message sponsored by your friends at Nightingale College. And we're pleased to be talking now with Allison Faust. How are you?
Good. How are you?
I'm well. Allison is with, we'll just say Live On Utah.
Sure.
LiveOnUtah.org. You administer programs that talk about safe and effective messaging when it comes to suicide prevention. So what does that mean? Why is it important? What is safe and effective messaging?
I love that question because the term safe messaging sounds so technical.
It does.
But essentially all we're saying is we have to talk about suicide and mental health in a way that makes people feel safe seeking help and lets them know that there's help available and recovery is possible if they're struggling. This isn't where it has to end.
Mm-hmm.
And so, yeah, through Live On Utah, we really try to give people the skills to speak about suicide and mental health in a way that promotes those messages of hope.
Things have changed quite a bit since, even since I started being involved with the walk 12 years ago or whatever it was. The terminologies have changed since then even. And for instance, one of the most prominent ones is we don't say committed anymore. It's committed suicide. We say person died by suicide. Explain that. Why is that?
Yeah. We really are essentially trying to elevate the conversation about mental health to be just as important as physical health, and treat it like a health issue. Suicide is a health issue. And what I mean by that is you wouldn't say that somebody committed cancer, right? They died from cancer.
It's not a willful act.
Right. They died from cancer and they died from suicide. And so we know that by changing our language like that, it can reduce stigma, and reducing stigma makes people feel safer seeking help.
What are some of the other safe messaging things that are important? Because, frankly, that's the only one I can think of that I really know. What are some of the safe messaging that you like to talk about?
I think a lot of it actually comes down to, unfortunately, when we work in this space, or when people are invested in the space of suicide prevention, it's a lot of times because we've lost someone ourselves, right? And we want to share those messages and make people aware of the issue. But how we do that is really important, meaning we need to stay on those messages of hope, right? After somebody dies by suicide, talking about resources, right? The National Suicide Prevention Lifeline, 988, normalizing therapy, kind of all of those things, and using images that are hopeful is really important as well.
And I think, as I was talking to Taryn Hyatt about this too, is sometimes people get too detailed and graphic about their loved one or someone acquaintance that has died by suicide, right? You get too detailed and too graphic, that's not a good idea.
Yeah, we don't ever want to share the method that they took their own life or the location that they took their own life, because we actually know that this can increase risk for others that are struggling.
Well, they say suicide is contagious. How do we know why that is or how that is? Or
it's contagious if we don't message appropriately after a death, I think. And so that's why safe messaging really is so important, because if we are promoting those messages of hope, a lot of times we don't see additional suicides after. But if messaging is done in a really graphic way, it doesn't provide a lot of hope for those that are struggling, and we might see additional deaths, and we want to avoid that.
Do we have any idea why? I know I've talked to people at the walk here in Salt Lake, and then I do the one up in Ogden as well, which is usually a week after. And I've talked to people who suicide seems prevalent in their families. Do we know why that is?
You know, suicide is so complex and individualized. I don't think you can ever say one reason, but I do think that sometimes suicide is driven by mental health issues, right? And so certainly mental health issues can run in a family, but that's not always the case. I think we actually do find that when it comes to suicide, sometimes people are just in this pit of despair and stress, and so much has happened in their life and they just don't know how to go on. And so sometimes it's not necessarily mental health related. And so we definitely have to address both sides of that.
We're talking about the 988 number that's in place now and has been for, well, I guess about a month now. I didn't think to ask this before, but can family members call that on behalf of someone in their family that is having a problem, or a friend that's having a problem?
Yeah, absolutely. I've done that several times for friends and family members, where they just kind of need that support, and you just sit there and say, can we call this line together? And you can call and you can sort of walk through that process with them. But you can also call if you don't know what to do. If you are aware that somebody is struggling, but you don't know how to reach out and have that conversation with them, you can call 988 and ask for advice. And they have trained crisis workers that can kind of give you some of those steps to take.
Is it difficult to, to try and have to tell a family how to talk about their loved ones? That seems sort of intrusive, doesn't it? And is it a hard thing? You probably have done it. How do you do it, and without? And do people say, just mind your own damn business? You know?
I think it's important that we're not trying to tell people how to grieve for their loved one, right? And most of the time, once we explain why safe messaging is important, and that we know through research that these things can increase risk or increase, recovery. People are pretty receptive, and we've had a lot of people want to work more with us after that.
What tools do you have that you can give to people if they need it?
So I really encourage everyone to visit liveonutah.org. We have hopeful messages that are vetted and safe messaging approved, and they can go and use those videos. Also, kind of a little teaser, if you don't mind. We are.
Oh, please.
We're launching the first ever safe messaging and suicide prevention training on Instagram in about 3 weeks. It'll come out the beginning of September, and it'll talk about that research and why you should share certain things and not others, and how you have these conversations and actually ask someone about suicide if they're having thoughts of suicide. And so if you follow Live on Utah on Instagram, we will be launching content come September. So
and anybody can access it?
It's absolutely free. All you need is an Instagram account.
Well, there are some things here that your office, or actually the AFSP, puts out about how to speak about suicide that are interesting to me, because I sort of don't understand some of them, and we could shed light on this. Why is it important to know your audience when talking about suicide?
That's such a good question. I think because we don't know who in our audience has been touched by suicide, and sometimes it's a little bit fresh. And so we have to sort of be aware of who, like whenever I do any sort of training, I always say, remember that this is a safe space, and if at any point you're triggered by this information, you can step out and we'll have someone come talk to you privately. Because sometimes you don't realize you're going to be triggering someone, or that somebody has lost someone recently. And so it's just important to kind of know who you're speaking to.
Tread lightly. Allison Faust is the Suicide Prevention Program Administrator. She's with liveonutah.org. Is that right? Org. We're talking about the best ways to message and talk about suicide. If you have, God forbid you ever have to do it. If you ever have to talk about it, but it's all too often people do have to talk about it. Tell us a little bit about why you think, or you probably have researched why suicide can be contagious.
So suicide, we see increases in suicide rates when messaging isn't done well after a suicide death. For example, if they we are sharing very publicly how and where that person died. That can increase risk for people who are maybe already thinking about suicide. And so we want to be very careful that after somebody dies by suicide, we are sharing where people can access resources and information, and just sort of raising awareness of the issue of suicide without talking about the specifics.
There's something here too that says don't glorify suicide, and at first I thought, well, why would anybody do it? But then you think about there's literature and there are movies and things about where somehow suicide is a noble act that was but the person was brave and did this, and that's just the wrong way to go, isn't it?
Yeah, I mean, I think a really good example that everybody probably is familiar with is like a story like Romeo and Juliet, right?
There you go.
Glorifying the idea of suicide, making it romantic in any way. We see a lot of stuff like this in TV shows or books and things like that, and it's just important to recognize that that's not always the best way to talk about suicide.
And the other thing I just noticed on your sheet here, which is something that people are probably guilty of, and I might have been myself. I lost my brother to suicide a few years ago. Don't talk about it in terms of it being successful.
Yeah, I do think it's important to recognize that we've all probably made those mistakes. This is new research that we've learned over the last several years. Suicide prevention is such a new field, and when you know better, you do better. So now that we know this information, we can kind of change our story. But I think that that kind of goes along with the idea of we don't want to say committed suicide or successful suicide. Somebody died by suicide, or if they lived, they are a survivor, right? It's not a failed attempt. They survived.
You got better.
Yeah.
I don't know if you can answer this, but, and this is sort of off topic, are there always signs? Because I don't know. I refer to my own situation, and I was shocked when I lost my brother. What? I had no idea. And then I of course beat myself up for a while, thinking I should have known.
Yeah. I don't think you can ever say there's always signs. I think that we know that most people show some sort of warning sign, but it's not always what we know to look for. Sometimes they're speaking about death, but sometimes it's just in their behavior. You just notice that something's different. But if we weren't trained to recognize those warning signs, we wouldn't have seen them. And so we have to kind of forgive ourselves for those sort of past situations and apply these skills moving forward.
It's liveonutah.org. People can go to that website, I assume, and find all of the stuff we've been talking about.
Yeah, we do have warning signs for suicide and resources for if you or a loved one is struggling. And then I encourage you to follow us on Instagram because we'll be launching some training come September.
Yeah, you mentioned that, but how is that going to happen? Is it going to be a series of Instagrams, and what's the format?
Yeah, essentially it's going to be a 10-week course that you can take and become a Live On ambassador, and you will learn how to message safely about suicide, what to share and not to share on your own social media platforms, and how to really start these kinds of difficult conversations with your friends, your family members, your coworkers, and spot those warning signs.
Allison, it's a pleasure to talk to you.
You as well.
Allison Faust, Suicide Prevention Program Administrator. It's a state office, State of Utah office. And please take advantage of the website, liveonutah.org, and the Live On campaign. And if you need help, call 988.
So much easier to say, isn't it?
Yeah, it is. I could never remember the 800 number. It's just 988 if you need help, or if you have a family member that needs help. Thanks for talking with us.
Thanks.
Life isn't always easy, but the advocates want you to know that there are places you can turn to for help and people that you can talk to. The Advocates are proud to join with the American Foundation for Suicide Prevention on September 10th to walk and bring awareness to suicide prevention and mental health. And remember, if you're in crisis, you can call 988.